AphasiaAccess is exactly the right name for an organization whose mission is to grow a network of healthcare, business, and community leaders to advance lifelong communication access for people with aphasia. But what do we mean by communication access? We all know what physical access is all about. For example, buildings are required to provide ramps for people in wheelchairs, so they have physical access to the building and can participate fully in the activities within that building. But the concept of communication access is a newer one, and its importance in the healthcare environment is less well understood. The importance of communication access in healthcare is illustrated by an incident that I remember about a person with severe aphasia following a stroke who was admitted to one of our inpatient rehabilitation units. He was alone without any family members who could convey medical information to the rehabilitation team. Over several days, the team became very concerned because this patient wasn't eating. He didn't seem to be interested in his food tray, and he was losing weight. So the team wondered about depression and whether he should be put on an antidepressant. The physician ordered a video fluoroscopic swallow assessment. His bedside swallow assessment had not shown anything abnormal, and they discussed obtaining a consult from a gastroenterologist. While waiting for this medical test, as well as consults with psychiatry and gastroenterology, a friend of the patient came to visit him and informed the staff that the patient was a vegan. He had not touched his food tray because he had been getting meat and eggs and cheese and other food items that were inconsistent with his preferred dietary habits. Had he been provided with the same communication access as a person without a communication disorder, giving him an opportunity to explain why he did not touch his food tray, it would have become apparent very quickly why he wasn't eating, before wasting time and money on unnecessary tests and referrals, and in view of the weight loss, before potentially compromising the patient's health. For those of us who work in a hospital, the importance of providing communication access to persons with aphasia and other communication disorders is now reflected in the standards of the Joint Commission on the Accreditation of Healthcare Organizations. The Joint Commission has developed a roadmap for hospitals. This is a free download to ensure that hospitals approach effective communication from the same perspective. Importantly, they indicate that no longer considered to be simply a patient's right, effective communication is now accepted as an essential component of quality care and safety. The Joint Commission defines effective communication as the successful joint establishment of meaning, wherein patients and healthcare providers exchange information, enabling patients to participate actively in their care from admission through discharge. They go on to state that effective communication requires a two-way process, two-way referring to both expressive and receptive processes, in which messages are negotiated until the information is correctly understood by both parties. Furthermore, they indicate that successful communication takes place only when providers understand and integrate the information gleaned from patients, and when patients comprehend accurate, timely, complete, and unambiguous messages from the providers in a way that enables them to participate responsibly in their care. According to the Joint Commission, a hospital must embed effective communication into the core activities of its system of care delivery to truly meet the needs of its patients, families, and communities served. This is not an easy task. Fortunately, the roadmap for hospitals does provide some ideas and recommendations on how to accomplish this in a manner that is consistent with the Joint Commission standards. I'd like to discuss two general approaches that can help an organization provide communication access to people who have aphasia. The first approach is to modify forms and materials to make sure that they are aphasia-friendly. In the hospital setting, there are lots of forms that patients are required to read, understand, and sign. These include admission and intake forms, informed consent documents, complaint forms, notices of patient rights and responsibilities, documents indicating eligibility criteria for certain benefits or services, or information about what patients should do when services or benefits are decreased or denied. Menu selections need to be completed, and within a hospital there are numerous signs to be read. These written materials are often inaccessible for people with aphasia and should be adapted to allow people with aphasia to read them with understanding. Some research studies have identified criteria related to content and design characteristics that can help to make a document aphasia-friendly. For example, using simplified vocabulary and syntax, large print, and increased white space increase the reading comprehension of people with aphasia. In addition, people with aphasia tended to comprehend more paragraphs when pictures were added, but selection of appropriate illustrations must be done cautiously to ensure that they truly convey the correct message and are adult-like and not childish. Here is an example of increasing communication access by using aphasia-friendly forms. At the hospital where I work, it is policy that all patients are asked by their care managers, licensed clinical social workers, if they have advanced directives and are given the opportunity to complete the appropriate forms if they wish. However, it was noted that patients with aphasia were not always asked directly about their advanced directive wishes, or family members were asked as proxy without consulting the person with aphasia. The typical advanced directives form, such as the one from the state of Illinois, is extremely complicated to read and understand. We developed a simpler form, and examples of it are shown here. As part of the development of the aphasia-friendly form, we held focus groups with several individuals with aphasia to get their feedback on whether the adapted form, including the pictures, conveyed the appropriate information to them. Based on their feedback, we made further modifications. The forms are now being used by the care managers, and we're evaluating the extent to which patients with aphasia are being directly asked about their advanced directives. However, it's not enough to only have aphasia-friendly materials. So the second approach to providing communication access involves training of hospital staff who come into contact with patients with aphasia. This includes not only the doctors, nurses, and allied health clinicians, but also, for example, housekeeping, dietary, and security personnel. They need to know how to communicate with individuals with aphasia and how to use the materials that have been developed to aid communication. We've recently completed a series of training sessions of primarily the allied health staff, PT, OT, and speech. As part of the training, we asked the staff to complete a survey before and immediately after the training, and then again 1 month later. We found that with the training, more than 80% of the staff reported increased knowledge and use of communication strategies. 1 month later, they reported using written keywords, hand drawings, number scales, written choice including simple yes-no options, gestures, and pictures to communicate with their patients. They also reported feeling more confident about communicating with patients with aphasia. They were better able to communicate with their patients, thereby optimizing and enhancing the quality of their treatment sessions. So, just like we think about physical access, it's essential that we consider increasing communication access for our patients. Consistent with the Joint Commission standards, we want to support effective communication that is specific to the needs of each patient and create an environment that is inclusive of all patients. Modification of materials to make them communication accessible and training staff in communication strategies can improve the safety and quality of healthcare, not only for people with aphasia, but also for the large numbers of non-English speakers trying to navigate the healthcare system on any given day. I hope you will join me and AphasiaAccess in the vision of all people with aphasia participating fully in life.